American Heart Month, we are going to continue our talk about heart health. Nurse Christina Paris joins us this morning to talk more about arrhythmias and more specifically AFib. Good morning, Nurse Christina. How are you doing today?
Good morning.
Good. Great to have you along. So, what is arrhythmia and how common are they?
So arrhythmias, there's more than 200,000 cases of AFib.
Okay.
So when we're talking about arrhythmia, I often will say when we think of the heart, there's either a structural, electrical, or a plumbing problem. So when we're talking arrhythmias, we're talking electrical. So the heart is not beating in sync like it should. So usually you have a right and a left upper chamber and a right and a left lower chamber, and the upper chamber pumps and then the lower chamber responds. But what happens is when people have AFib, it's irregular. So it's not coming from where it should, and it kind of quivers. So if you think of like a rushing stream, when blood rushes through our body, it's pumped by the heart. And when the heart isn't working right, it's more like a babbling brook. And what can happen is that you can have blood that sort of sits in different areas of the heart, and it can cause blood clots and things like that. So that's where it becomes a problem.
Oh, interesting. So what are the symptoms that we should all look out for?
So you're going to look for things like heart palpitations, feel like your heart is racing or it's beating really irregular. Shortness of breath, sometimes it can be mild, just like fatigue, or with exercise you feel really like, boy, I could do this walk before and now I'm really tired. Weakness, your reduced ability to just even be physically active. Lightheadedness, confusion, chest pain. Sometimes it's just a mild tightening of the chest, and sometimes it's a little stronger. Maybe you'll pass out or feel faint, like you're going to pass out, and don't really. So those are some of the kind of more common symptoms that people will see.
All right, so it's very interesting to hear about. So then how is this issue treated? So
it's treated different ways. Sometimes we want to treat the arrhythmia, if possible, and you can do that with cardioversion, where we try to essentially reset the heart, get it to go back into its normal rhythm so that it pumps effectively. Sometimes there's more long-term treatments with medication management, but there's a new thing out, and it's called a Watchman Device, and we're hearing about it more in this area. They're using it more frequently. And what it does, there's a little part in the heart, it's a little appendage. It's like a little sac off of the heart. And when blood kind of pools, like I said, it will, sometimes with atrial fib, that is an area, it's the left atrial appendage, and it's an area where blood often pools and it can cause a clot. So what they do is they go in with this Watchman device, and they can kind of block that area off so that blood can't sit in there and pool. They get rid of that little that area. I don't know how else to describe it. And it's been effective. So that's something that they're looking at. But there's other mechanical devices and mostly medication management.
Gotcha. All right, that's very interesting to hear about. But so if this is left untreated, what are your side effects? What can happen from this?
So you can, well, a lot of people, stroke is the biggest issue. And then just not having effective contractions of your heart. Your body needs the heart to pump effectively so that you can get oxygen to every cell of your body. It needs oxygen, it needs nutrition. So blood pumping effectively is super important. So if it's untreated and you're just not getting that, it can just cause all sorts of issues. Right, nobody wants to feel tired and fatigued and punky, and no one wants to have a stroke. So that's the biggest thing.
So definitely go get checked if you definitely feel those symptoms, for sure.
And patients will say really quick that they'll feel it right away. Like, oh, I can tell that my heart is racing. So yeah, you feel something weird.
All right, well, thank you. Learn something new every week with you. So thank you so much, Nurse Christina, for coming in. We will see you next week.
Sounds good.